Good morning. Welcome and thank you for joining us for our Northern Light Health Business to Business Zoom conference. Today our theme is planning for an uncertain future. We're making good progress with vaccinating people, yet the number of people hospitalized and cases of viral variants are not as good as hoped for. The possibility of another surge in cases looms. We'll talk about the latest on COVID-19 and vaccinations, working with a budget, managing personal protective equipment, and preparing for the summer tourist season from the perspective of a Maine business owner. I'm Dr. Ed Gilkey, Senior Physician Executive at Northern Light Beacon Health. I'll be your moderator for the next hour. Our panelists today are Brian Langley, owner of the Union River Lobster Pot Restaurant, John Doyle, Vice President of Finance at Northern Light Health, Mary McCarthy, Director of Supply Chain at Northern Light Health, and Dr. Jim Jarvis, Director of Clinical Education and Incident Command Section Chief at Northern Light Health. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. A reminder, this hour is for you. If at any time you have a question for one of our panelists, please use the chat function. I'll keep track of your questions and have our speakers respond. Also, I hope each of you will take a few minutes immediately following this hour to answer our quick 5-question survey. Your input directly affects our topics and helps guide our future conferences. Our panelists will share some key information first, then we will have questions and answers. First up is Dr. Jarvis, who will provide us with an update on the COVID-19 vaccination program. Dr. Jarvis?
Thank you, Ed. If I can have my first slide. So I'll talk a little bit about vaccine eligibility. Starting in March, the governor had lowered the age of eligibility down to 60 and over, and also then included teachers, staff, and child care workers from K through 12 and pre-K to the roles at the direction of President Biden, who wanted to have as many of the school staff and child care workers at least receive their first vaccine by the end of March. And so we've been able to comply with that. It's been an interesting change to see a younger crowd of people coming through than the age over 70 that we have been doing for the last month and a half. But that has worked out very well. I'll remind people that proof of eligibility needs to be brought with you, meaning that you have to be both a Maine resident and if you're under the age of 60, that you have to have proof of employment in those categories. And if there's specific questions about those, we can talk about that. It is the intention that Maine will lower that age to for eligibility to 50 and over starting in April. That may happen a little bit sooner depending on how things go with our current status in terms of both vaccine and clinics. So stay tuned on that. And then under the presidential directive, President Biden has asked that all states remove age restrictions for eligibility for vaccines starting the 1st of May. So that would include anybody over age 16, because as we've talked about before, the Pfizer vaccine is approved for age 16 and above. The Moderna vaccine and the Johnson & Johnson vaccine are approved for people 18 and above. course, all of this depends on vaccine supply and logistics. And so I caution everybody that on May 1st, it doesn't mean that everybody gets vaccinated on May 1st. That simply means that we will be able to open up our scheduling process for all individuals that meet that criteria to schedule into appointments pending vaccine supplies. It will still take quite a bit of time. Right now, Maine is a little bit over about 50% of the population having their first dose of either Pfizer or Moderna. Some have completed their series for Johnson & Johnson already, but we still have lots of people who need their second dose of Pfizer and Moderna, as well as all those individuals who have yet to qualify. Our hope is that sometime during the summer, we will find out that children of any particular age may also be able to get vaccinated, which would be very welcomed news as well. We know that all three of these vaccines have started trials with people under the age of 18 in various age groups, some down to age 8, some down to age 6, and some down to actually newborn age. And so, so more to come on that, and we will continue to update as we need to. Next slide, please. So there was also some changes that came out at the beginning of the week as to what it means as far as restrictions go for those who have been fully vaccinated. And the definition of fully vaccinated is that you have had 2 weeks after your second dose in a 2-dose series like the Pfizer or Moderna vaccine, or 2 weeks after the single dose vaccine like Johnson & Johnson's vaccine. And so it's not that after you get your shot, you're done. You do have to wait those 14 days before the new restrictions apply to you. So next slide, talk a little bit about that. So basically this came out from the federal CDC, of which Maine has adopted those same guidelines. So if you've been fully vaccinated, you can gather indoors with other people who are fully vaccinated without wearing a mask. So that's welcome news in families who have been able to get completely vaccinated. You can also gather indoors with unvaccinated people from one other household. Typically, we talk about relatives who all live together without masks. But the caveat there is to make sure that no one in that little pot of people has any increased or severe illness from COVID-19. So that means, are they over the age of 60? Do they have any heart or lung problems? Are they immunocompromised in any way, being treated for cancer, or pregnant? And so you just need to kind of be careful and do that. And then as far as being around others, you could still be exposed to COVID-19. And so if you're in a group setting, we continue to say that you need to remain, you need to be guarded about that. But if you've been exposed to somebody with COVID-19, unless you yourself have symptoms, you no longer have to quarantine. So that's welcome news for people who are out and about. What we didn't talk about was travel changes, and that's because Maine did not adopt any travel changes, and the CDC did not put any specific guidance out yet regarding vaccination, with the exception of one area. And so right now, Maine has lifted some travel restrictions from neighbors in New England, and so that needs to be, you need to check on that about whether you need to quarantine from coming back from a visit to one of our neighboring states. But if you have been completely vaccinated, returning from any state allows you to avoid needing to do the testing-based strategy to get out of quarantine. This does not apply to international travel. International travel has more restrictions actually on it now, which is that after return from international travel, you have to either quarantine for 14 days or 10 days with a negative test. And so that's a little bit different than we had before, and most of it has to do with the variants that are out there. I think that's my last slide.
So Jim, Maine CDC would be a good source of that travel information?
That would be, and and you have to kind of check it frequently because things change fast in the COVID world.
Mm-hmm.
And so I always make sure that I check to see which states are on the exempt list, that we can travel overnight and come back and not need to quarantine, and then make sure that if there's an area of high prevalence of disease, I will tell you that the state would probably put those quarantines in for specific states. So we may actually see an exempt list and then like a super quarantine list in the coming days.
Great. Well, thank you. And thanks for that presentation. Next up is John Doyle, who will share some budget tips with us. John? You may be on mute.
All right, thank you, Dr. Gilkey, and good morning, everyone. So what is a budget? Well, it's a financial plan spanning a period of time, and typically we have a year. And it's really based on assumptions of the competitive environment and the company's capabilities. And we use it to set performance targets for ourselves, and one of which could be your cash on hand or your days in accounts receivable, things like that that show how the company is operating. It has revenues and expenses, and what's important is it compares your actual results to what you thought you would see from the budget. So that is done on a monthly basis or some interval of time. Next, please. So how is it created? In the case of an existing organization, you take your historical data. But if you have a new company, you want to use your financial plan that you put together to set your company a sail. And if you're using historical data, you have to understand the current and projected market conditions. So knowing where you were, and then secondly, where you think you're going to go, and factor in any technological advances. And we'll talk about that a little later. But another key point, and we've certainly all lived this through COVID, is know the regulatory issues. And they change, they can change rather rapidly, but understand how you have to react to and abide by those regulatory issues, and also if there's tax implications to what you're trying to do. And then the other part is forecast your sales and base that on volumes or other things, and look at pricing, how you're going to price yourselves in the market. Try to break apart expenses between fixed and variable expenses, and then staffing. Have that fully loaded staffing costs with all benefits to the extent you have them for your employees. And then look at advertising and promotions. What can you afford to do, and what is the return you expect to get from those expenditures? And really what you want to do is come away with a complete financial picture of what you expect to happen. So you set a plan together, and this is what we expect to happen during the course of a year. Next page, please. So what it does, it creates financial discipline. You've spent the time, you've looked at it, and this is said how we are going to, work our plan for the year. And it gives you a roadmap of where to go. But a key point is it alerts you when you need to make a course correction. You have to reassess the budget in light of the current market conditions. So is it still applicable how you set out to do things? So if there is a change, but be deliberative about how you make that change. Because you spent time on the budget, you really had all that thinking, and you talk to others. So be careful about making a change. But when you do, again, do it well, but be proactive, because this is a time of opportunity. Change brings opportunity for many. So really seize that opportunity and move forward. But again, spend the time to plan going forward. And then always finding solutions, always have communication, open channels with your business associations, professional advisors, and elected officials are key. What they see, what are they pushing for? You have to have their ear to protect your company. It also supports borrowing from banks or investors, but it really sets you on a path for success. That's what the budget is intended to do. And one of the key phrases from a leader who I have a lot of regard for was, plan the work and work the plan. That's dear to me, that saying. So, what are the tools involved? So we have basic spreadsheets. You can have Excel, or you can have a fully integrated budgeting solution. There's so many on the marketplace, and they're off the shelf, but you really want to make sure that it integrates with your financial systems or your accounting and accounts payable, accounts receivable, because what you don't want to have is a lot of work to maintain the budget and to do analysis. You want to have that integration to the extent at all possible. And talk to others in your industry, and talk to your financial folks, your accountants, your lawyers, whomever, to really see what they've heard from their client base, and to really make that wise decision about where you're going to invest your money to have these solutions from a budget perspective. You want something that matches up with your accounting information. You don't want to be copying information or keying in information. You want to have, again, what I strive for is that integration. And lastly, you can't just do the budget and put it on the shelf and just leave it there and say, okay, we did that, check it off the list. And really this year has been so emblematic of why that's important. So, COVID came and changed everybody's world. Some companies actually had a great increase in their business. Many, including us, the hospitals, did not. We had a reduction, roughly 50% of our business, and a lot of that was taken up because of elective procedures. We were told not to perform them, and also have non-emergent visits to really try to cancel them as best we could to really tamp down the spread of the disease. So what we had to do is, how can we still deliver care? Well, obviously we're a hospital, so we take care of the patients that come to us and need that care. But for those patients that didn't have emergency care and just needed ongoing care, we really looked to telemedicine. That was a technology that we've used in the past in varying degrees, depending on the hospital. But really, that was one of the ways we kept connected to our patients. We still were to deliver care in a different medium. And that's where the technology piece is so important, how you react. Now, those of you in the restaurant business, some of you changed to takeout. It's that kind of reaction, something you had never maybe thought of before or did in varying, in lesser degrees, but you had to react to keep your company going. And that's where that vision, and also learning from others and just working through what the problems are. The other part we have here is there's just some other budget tools, but there's a rolling budget. And that might be very important in this type of environment, in the sense that you're budgeting not for the whole year that we may have done in the beginning of the year, but we're saying, okay, let's do it in increments of 3 months or 2 months or something like that. You could do a month forecast also. It's just how you can, again, have some financial discipline about where you expect your company to go. And from there, you can compare to how you're actually performing against that plan. And the other part is a flexible budget, which actually allows you to put in your actual, we'll say, volumes or revenue. And then from there, if it's built appropriately, it would recalculate all of your expenses. So you can see, with this amount of volume, and here's my recasted expenses, how am I performing against actual? Because it always comes back to, how are you performing against actual, and are you sustainable going forward and really in keeping with your plan? So that's it for budget, I think, for me.
Great. Well, thanks, John. Next is Mary McCarthy, who will take a critical look at PPE. Mary?
Thank you for having me. And we've got some interesting information about PPE. I'm sure a year ago, not many of you knew what PPE was, and it's been quite the hot topic in the media for the past year. We've gone through a roller coaster ride of types of PPE that have been recalled, the lack of PPE, manufacturing plants shutting down, moving products to manufacture outside the country back into the United States. So there's been a lot. It's been a moving target, to say the least. And so I just wanted to go over some basics with you of things that we have found very helpful. And again, education, training, communication, and awareness, those are the key things that we teach our staff all of the time. When we speak about physical distancing, that 6 foot is so important. So in your businesses, there's a lot of tools out there that you can put circles on the floor, and on those circles you can say, hey, Tuesdays we have 20% off for XYZ. Posters on the wall, you can develop your own posters that will keep people aware of what you're doing to keep them and your staff safe and the community safe. Hand washing, soap and water for 20 seconds is the recommendation by all governing bodies. The hand gels, hand gels are very effective, but you want to make sure you're using a hand gel that's safe for you. So some hand gels had been marketed with ethanol in them, and ethanol contains a methanol, which is very dangerous. If it's absorbed into the skin, it can become toxic, or if it's ingested, it can be life-threatening. So really make sure that you're reading the labels on some of your hand sanitizing products. And I would steer you towards the CDC, the EPA, and the FDA for lists of products that are safe. Another thing is, trying to teach people to really wash your hands for that 20 seconds, or using the hand sanitizer with vigorous scrubbing for 10 seconds. There's actually a a lyric generator at washyourlyrics.com. So you can make it fun. If you've got, younger folks in your businesses or even in your home, you can develop songs like a song of the week that they can sing while they're washing their hands to ensure that they're getting that appropriate time in there. Cleaning and disinfecting frequently touched objects, your cell phones, your glasses that you wear on your face, we're always adjusting those. Alcohol wipes, 70% isopropyl alcohol, your monitor screens, your keyboards, your phone, your iPad. That's a great product to use to disinfect those types of devices. Right now, there's still, I think, obviously we're only a year into this, and there's still a lot of research and data that's coming out on a daily basis. So please keep yourself up to date on those. Right now they're saying that the virus can stay live on a doorknob for up to 5 days, or on wood for 4 days, glass for 5 days, and plastics 2 to 3 days. So you really want to be very mindful of wiping those things down on a very regular basis. Another thing is, a lot of us, whoops, something happened to my slide, but a lot of us touch our faces, our eyes, nose, and mouth frequently. If you do that, have something in your hand to fiddle with, especially if you're listening to somebody or what have you. Keeping your hands busy keeps them out of your orifices on your face. And then your face mask. Unfortunately, there's been a lot of counterfeit products on the market, and people take advantage of tough times. And so you really want to make sure that you're purchasing your PPE products from reputable vendors. They may only be $1 a box in your resale store or someplace along the side of the road. Please don't buy those. I'm not saying that they may not protect you from the filtration properties, but some of them have products in them that can cause skin irritation, can cause breathing irritation, can cause eye irritation. So it's really good that you know where the products are coming from that you're purchasing. Next slide. So waiting for that to come through here, but there's some great websites. I know that Dr. Jarvis has mentioned them in the past to you, but these are really your go-tos. You want to go on these sites. They have a lot of great resources, and they're validated. They're evidence-based. They're the top recommendations from our governing bodies. And always make sure that the disinfecting products that you're using are on the N list, and that N list is updated very regularly. So you can go on there, and actually there's a search tool where you can put in a product that you may be thinking of buying to clean your work surfaces and your work areas in your home. Make sure that it's on that list to ensure that you're killing for the appropriate viruses that are intended for the actual use. On the Occupational Safety and Health Administration website, there's all kinds of great tools for businesses and workplaces, and just educational tools too if you're onboarding new employees, with onboarding things, again, posters and materials that are very good with visual, quick information types of things. Next slide. This is just a quote from the chief at the FBI financial crime section. And criminals are very opportunistic, and they really prey upon vulnerabilities of our population when we're in times of need. So these are 3 companies that we work very regularly with. We are very confident in the products that we purchase from them. The customer service is wonderful, and I had reached out to all of 3 of these companies to say, how do you help the business owner or the small business owner or somebody who's running a child care out of their home or out of a facility. They'd all be very happy to work with you. You can set up accounts with them, and they can also give you guidance on what is effective and is not effective. So I would highly recommend, again, going through a reputable distributor or a vendor to make sure that you are buying quality products. Another key thing that we've learned along the way, a lot of us wear glasses, and we have masks on at the same time, and our glasses fog up. So there's a home remedy that you can all make with 50% baby shampoo, 40% of your Blue Dawn, has to be blue, and 10% water. You can shake that up in a bottle, spray it on your glasses, or if you've got a face shield or safety glasses, let it rest for about 30 seconds, and then wipe it down, and do that a couple of times a day, and it really significantly decreases the amount of fog on your protective eyewear. And with that, I will pass it along. Thank you.
Yeah, well, thanks, Mary. Really awesome, useful information. Thank you. Brian Langley has been a frequent participant in this series. He has asked probing questions and has offered us great feedback. He has agreed to join us today to share how he is preparing for this summer season by reflecting on lessons learned this past year. We could call this segment the Owner's Eye View. Brian, thanks.
Thanks, Dr. Gilkey. And as usual, just listening today has provided me with some great help. I wear glasses, so that last segment just now was just perfect. Because they fog up like crazy, and it's really hard to work some days with that. But Dr. Gilkey and the rest of the folks that are here today, thank you so much for putting these on. My name is Brian Langley. I own and operate the Union River Lobster Pot in downtown Ellsworth. Last year was our 25th year, and we weren't so sure going into it this time last year if there was going to be a 25th or 26th year. So the world came crashing down on us at this point last year. When it landed on us, we were watching what was going on because we're seasonal. We saw restaurants close, to dining in, and then some places closed for 2 or 3 weeks until they figured out how they could do takeout only. And so we gathered together as a group of us restaurant owners in Ellsworth and met one afternoon up at Helen's to talk about what we could do to get a message out to our customers that we were on top of this as a community of restaurants, and to assure them that they were going to be safe. So, it's funny, brought up at that time, talking about taking temperatures, with those sort of infrared temperature guns. And, at that time, people thought that was outlandish. But you go in now anywhere around town, if you go to get your hair cut, they're taking your temperature. So what was seemingly outlandish a year ago now is seemingly to be common practice. So when we saw this happening last year, we decided to wait before we open. We open usually the 1st of June, and we decided we would hold off till about the middle of June as the summer tourist season was starting, and then to see what was going to happen with the restaurant industry. And unfortunately, we opened, I think, on the 13th of June, and right around the 10th or 11th of June, they allowed indoor dining with a 6-foot separation. So prior to that, we ran through a little bit of a process. This had landed on us. It totally changed our view of things, and we embraced this, is that we could not do business as usual. But how are we going to figure out what to do? So we employed a kind of a 3-step process in our decision making. We assessed our facilities, we assessed our people, and then our processes. What assets do we have that were available to us, and then what changes were we going to have to make? So in our facilities, we looked at, we were following all of the guidelines. We installed plexiglass, we rebuilt bathrooms, we added counters, we worked on our traffic flow so that people would have one-way traffic in one door, place their order, and go out another door. Now, for any of you who've been to the Union River Lobster Pot for 25 years or 24 years, you've come in, sat down, been waited on, somebody brought you to your seat, you had a server, things were delivered to you. And we had to flip 180 degrees and say, how are we going to protect our employees, and how are we going to protect our customers, and how are we going to be able to make any kind of a living? So that all factored into that. We are very fortunate to have great staff working for us. I hire a lot of teachers and college students. We have very bright people working for us, and they were very instrumental in helping us fine-tune our policies. And then assessing our processes. We had to invest money in a new website, online ordering, contactless payment, curbside delivery. You see the picture here. This is my grandson, Itsuki, who's my lobster cook. And so he's masked up, and then curbside delivery is something we'd never done before. So we had all of these really new processes that we had to learn and fine tune as we went along. And to that, so we had, like I said, we had delayed our opening. We lost 2/3 of our seating. We had to invest in, hand sanitizers and stations. We had those already to begin with in the restaurant. Those are all common things, but we had to put them everywhere. And disinfectants, I think, as Mary was talking a bit, we had to now work with our normal disinfectants, which are, food grade. And then on top of it, we had to get disinfectants that had, a 45-second virus kill capability to them for doing tables and chairs and doorknobs and bathrooms. So we now had to juggle, different kinds of, ways to sanitize. Then we bought masks for customers, employees. And then, as I said, we created a new traffic flow for customer contact. One of the things we very quickly found out is how are we going to convey all of this, that ever-changing protocols to our employees to keep them safe and our customers safe. Fortunately for us, Hospitality Maine, which is the trade association for the innkeepers and the restaurant owners, had worked with Eastern Maine Community College and developed an online training course that gave a digital credential, gave a certification when they were done. I had all of my staff do that, and it was very helpful to have a similar message on there. And from that, one of my employees, who happened to also work for Blue Hill Hospital, and I'd had this conversation with you folks, had developed a script based on what the folks at Blue Hill Hospital had been trained, and how everybody had the same message that worked there. And so this young lady, who had just finished up her MBA in healthcare administration, drafted a script for us for every sort of scenario. If someone gets up without a mask from a table, or too many people are trying to go into the bathroom, or somebody at the front entrance, how to respond in a good way, non-confrontational, and de-escalating. There was a fair amount of that at the beginning, really kind of angry people that their world had changed. And I couldn't blame them, really. So all of my staff was trained, and we attribute that to our success in keeping our staff safe, not a single case, and all of our guests safe. We put a greeter outside because we wanted to keep the conflicts outside of the building. You don't want somebody yelling inside the restaurant, because it really gets ugly. So we sat people outside there, and it had the signage with the rules. We handed out masks. We had hand sanitizer. And for folks that really were kind of upset about that, we didn't lose many, but some got back in their cars and said they'd come back after the pandemic was over. So I hope they found somewhere to eat. So we redid our signage, as I think Mary was talking about, for traffic flow and hand washing. We put those up everywhere, and in a nice way, try to encourage good behavior. Online ordering, something we'd never done, was tricky for us to manage, but we had to do that in curbside pickup. And then lastly, we closed early. The stressors on my staff, I have high school students, I had college students, I had teachers, both elementary and high school teachers working, and for years they'd, work for me in the summers and then into the fall, as school was starting, and the stress every day became to be too much when they would come in the door to work, so wound up because now they're teaching kids at home, and their kids aren't liking it, and they're not getting the results they want, and so they're fighting with kids every day in the morning, and then they're trying to come into work. So about the middle of September, we said, hey, we had made it through this far of the season. It's time to go. So but in our conversations about my wife and I having conversations about whether we should even open or not, right? So if you talk, this morning, someone from the Tourism Association was on the radio saying a number of businesses didn't open up. And we've been 25 years here at the bottom of, Main Street in Ellsworth. And we personally felt the responsibility to our community in Ellsworth to be open and help, number one, to help our community survive the pandemic, and then be around to help our community thrive. And so we looked at it a little bit of a different lens and say it would have been cheaper to just close for the summer, go to the bank, extend your line of credit, pay your bills. But 25 families that work for us are counting on income. And so that weighed heavily on us. And two, one of our assets was we have space. So we put, 10 picnic tables outside and put it down near the water. And people could come and feel safe. We saw a lot of that. So, restaurants and eateries, they're the center of what makes a community. And certainly we worked with our community theater here and brought music in, and we did Shakespeare on the River as a fundraiser for the Grand. And I see in the audience, you've got someone from the Grand Theater watching this. And so we teamed up with our other community members to say, hey, how can we work together to really, we saw it in our customers' eyes when they came and sat outside and watched a funny rendition of Shakespeare, and could have a lobster roll, piece of blueberry pie, and a cold airline brewery beer. Something felt normal for them. So, that was our goal. So from there, I know that, part of this, got invited here is, what's it going to look like in the future? What are we, planning for this summer? Well, we looked at this as an opportunity to make changes that our customers would never let us do. So when you have a successful business and people get used to, things a certain way, and they like what you do, and you say, maybe I should change some things, and you're going to get some grief if you try to do something a little bit different than you normally have done. Well, the pandemic provided us an opportunity, and this is what I said to my colleagues: use this as an opportunity to change those things that you thought maybe need to be changed, but your customers would never let you do it. So we embraced this as an opportunity, and we knew that we could not operate as we had in the past. But what could we try out to see that might work when we're post-pandemic, that people might like? We served outdoors, we expanded our operating hours. We put in online ordering, takeout, curbside, tried some fun new menu items, lobster poutine, I kind of put on tongue in cheek. Our goal was to say, look, our folks, in Maine can't go to the Blue Hill Fair, the Bangor State Fair. The festivals are out, and food is a big part of that. So we put in fairground fries. We made some, fun, pulled pork French fries. We cut homemade French fries, did lobster poutine. We did a Connecticut style lobster roll, just let's try to have some fun with this, and see what people might react to. People were a little bit forgiving most of the time. So like I said, some people were not happy about the world. So that's, really what we looked at what we're going to keep. And then lastly, the purpose of, I think, why people, asked me to come on is like, how are we going to plan for 2021? And frankly, you guys are a big part of this. The seminars that you've done throughout the spring here, since I've been watching these for the past few months, each and every time I come on here, I learn a little bit something. And it's, even if it's to know that things are ever changing, right? So knowing that things are, you have to look each week. We coined a phrase last week when people asked us long range plans, and we don't have any. We're working on 1 week horizons and just paying attention to what's going on. But one of the things that was really fun out of last summer, we moving outside and putting our people outside. there's a family of ducks every year that a lot of ducks are born on the Union River. And so they adopted my customers, and they would, as they grew bigger, they started out really tiny. They would waddle up onto the lawn and come up next to the picnic table and just kind of sit there until someone tossed them a French fry. And I had one mother say to me that on the way in, her kids were all wound up. They'd been in the car. Things are tense anyways. People were pretty tense last summer. And then she said the ducks came up to the table and just calmed her kids down. It was better than therapy. And I noticed that was what was happening. That people, ducks don't know there's a pandemic, so they would come up and kind of sit and waddle around and come visit you at your table. So I made these T-shirts. We have therapy ducks. They keep you from quacking up. And my staff loved wearing them, and people got a kick out of it. So I guess in the sense of this, you got to have a little bit of humor. So. We're using everything that we've learned here to try to plan for the summer, and and try to do what it looks like, a little bit of what we did last year, only try to get better at it. So I see Dr. Gilkey has come on, and that's the hook. Thank you, Dr. Gilkey.
Yeah. Thanks, Brian. And I want to put my nickel down and say your creative problem solving is very inspirational. I think we all are learning from you. So now let's focus on questions. Today's Q&A session will start with questions Brian has for our experts. Your questions will be incorporated into this format. I will group similar questions together so we can address as many questions as possible. And I'll start by first reflecting on the chat room. And Mary McCarthy has shared that secret formula, 50-40-10, for everyone to take a look at. I'm starting to think about, boy, maybe that would be useful for goggles underwater even. Having said that, we also recognize that our horizons can be as short as 1 day, 1 week. Certainly 6 months is in our mirror right now. So, Brian, I realize you have many issues to address in your business. I mean, there's so many things to think about. What questions do you have for Dr. Jarvis regarding the coronavirus and/or the vaccines?
Thanks. I was on the phone this morning with some folks at the Tourism Association, trying to glean information from everywhere. And it really was about, as the vaccines increase in Maine and other states, will there be recommendations from the medical community or from government regulatory agencies for proof of vaccination? And I've been reading some articles about, vaccine passports, and I'm concerned about what that might mean for operators, if we have to kind of get into the regulatory side of it, of having people, prove that they've been vaccinated.
Yeah, so Brian, first of all, I want to echo what Ed said. Quite inspirational. Lots of good take-home points, and I love that you decided that you didn't want to close. Instead, you wanted to expand during a pandemic. So kudos to you on that. So vaccine passports. Right now, we don't see that there's going to be some government issues around that. Like the government will say, you have to have a vaccine passport to do X, Y, or Z. We really think that it's probably going to be led by private industries. One big one that I can see that happening with is air travel. So I could see that airlines might say, in order to board our plane or to sit in a certain section of the plane, you have to show proof of vaccination. We do know that certain travel internationally will require something like that. We've seen that in the past. So many of us might remember, if we're old enough, that there was the yellow fever passport. You had to have shown that you were vaccinated against yellow fever in order to travel to certain countries. And in fact, in order to return to the United States at one point, you needed to show proof of vaccination. So we assume that is coming. We just don't know when. As far as the passports go, right now, the intention is to use those cards that we use, that we issue you when you get vaccinated. I do know that there was at least an article in one of the major papers, an opinion piece saying, well, those cards are easily forged. But then they proceeded to talk all about the yellow fever vaccination cards that we all had, which, oh, by the way, were completely handwritten on. And so I think this is where we use a little bit better technology across Northern Light. Of course, we use stickers instead instead of handwriting on it. So it's a little bit more controlled. It actually looks like it's something that's official. I will say that the major electronic health records companies in the United States are working on having a virtual passport that could show proof of immunization and something you could show on your cell phone. They already have this developed in Europe, and so hopefully we'll have that in the United States as well. We always seem to trail a little bit behind. As far as a business like yours policing it, I don't think anybody is thinking that that's what we need to do. It is hard enough for the police just asking people the symptoms questions that we've had, or to enforce wearing masks when appropriate. And so I think, adding that burden as you look to your future, I don't think that's going to be necessary, nor would you really want to be in that kind of position. And I don't think we're going to be in that position either in the healthcare industry. Now, what might change is there may be some recommendations or private companies that say, hey, my staff or my employees need to be vaccinated because what we do is a high risk field and I want them to feel safe and comfortable in their environment. But that has not happened yet, but I can see that happening probably starting in the fall, maybe a year from now. That'll be a more common thing that private businesses would say. So excellent question.
So Jim, we would certainly encourage people to hang on to those cards though and have them readily available, wouldn't you say?
Yes, I recommend that you take a picture of it, particularly after you've gotten your second dose, but you might want to get it before. We've had a number of people who have lost their card in between their first and second dose. And while we're able to reproduce the card, it's much easier if we have a picture to go off of. And so I took a picture of mine. I've had people ask me, well, if I laminate it, will it still be legal? First of all, it's not really a legal document, but yes, it would still be legal. The only problem is it doesn't then give you a spot where you can then put a booster if boosters are recommended, but I think it's perfectly okay. I have also noticed that through the clinic that it always seems to be that the wife turns to the husband and says, now hand me your card. And that's probably good advice too, because many of us might lose it. So that's my one sexist comment about men. And I'll end there.
Well, before you get into further trouble, Brian, many decisions over the next few months will have financial impacts. I mean, just like opening late, closing early, so lots of financial impacts. What questions do you have for John Doyle?
Thanks. And I again today was really helpful and informative. We're sitting here looking to figure out what the summer is going to look like, and the question that I had for somebody who's a kind of an expert in budgeting, and I'm an expert in cooking lobsters. But how do we balance hope with reality when it comes to budgeting for 2021? There's a lot of optimism out there, but then you hear there's variance, and and things could come back around. So we have sales figures for 2019. We have sales figures for 2020, which is about 50 to 60% of 2019. And we are counting on a better 2021 season. But what kind of advice would you get for how to approach the budget planning process for 2021? I could really use some help.
Yeah, I think, Brian, what's important is to understand a trend. If you have the past 3 months, is there some way to tease out any sort of trend line? Is it going up? Is it going down? You have to balance that also with, again, the regulations and where you think the owner is where it's going to go as far as the customers coming back. I think the other great resource is to talk to your customers. You have those loyal customers that are taking, in your instance, takeout and the like. But how about asking them what their friends are going to do? I truly believe there's pent-up demand out there, and it's how to try to divine through that and understand where you can go. But what's important is to understand how quickly, we can get back to normalcy or back to your volumes. But again, and talk, as I mentioned earlier, talk to other similar groups in your industry. And you did that, Brian. You went to Helen's. I mean, I think it's great that the groups get together and share that information. I mean, collectively, the brains are much more powerful than a singular brain. So I would say talk a lot, look for trends, and watch the government, the regulations and mandates, really.
Yeah, thanks, John. Brian, first you had to deal with procuring PPE. Then you needed to worry about whether it was manufactured properly. What questions related to supply chain do you have for Mary?
Again, Dr. Gilkey today was really informative. Each time I come away with something that I can use. And last summer, we were faced with having to scramble and try to find PPE supplies. They cost us a ton of money. Disposable gloves quadrupled in price, and then there was a time when you couldn't get them. Masks range from $1.50 a piece to sometimes look like $3. So and Mary provided with some names and resources today, but I just wondered from her perspective, and Mary, from your perspective, is the supply chain stable now? And for ordering and buying purposes, do you anticipate that these PPE protocols will be in place all summer and fall? I mean, so, are we looking to do this right, straight through to, October, November, kind of when the season ends?
Yeah, thanks for the question. I foresee that PPE is going to be required for a long time to come. I think the use of face masks and all of the additional things that we've done to protect ourselves and our communities, if you look at the flu rate in Maine and across the country, it's shown that we've had very small flu spread. As far as the price gouging, when I find anything that's way overpriced, I submit it to the FDA. There's actually a place on the FDA website that you can submit when companies are really price gouging beyond what their costs are. So that's a good thing, and then they keep a close eye on that. But again, I think if you work with a reputable company and that you establish an account and a relationship with that company, they will be able to find you safe PPE and supplies. And, it's a roller coaster right now. Some days we're doing great, like the vaccination supplies. Sometimes we're doing great. And then all of a sudden, 1 week, there's no 1 ml syringes to be found so that we could administer the vaccine. So unfortunately, it's still very unpredictable and very unstable.
Great. Well, thanks, Mary. Brian, I have a couple questions for you. And this is actually a type of question I used to ask of our resident physicians in training when I was a faculty. As a business owner, what are your best sources for current COVID-19 information?
Well, I would say that this webinar, and I've told as many people as I can about this, as a business owner, what's really happened, I think, in our society now, and you could spend probably several shows on this, is that there's a mistrust out there about whether the information that you're getting is real and hasn't been shaded one way or another. And I've really appreciated very much Dr. Jarvis, Mary, John, all the people that you've had on here, that you just provide the information and what's happening. And so, and now I haven't always liked the answers of what's come up, like everybody wants this to be over. But knowing just asking the question, is this going to be here all summer? That's very, very helpful to me. So what I know now is that probably run very close to the way I did last summer, but I'm going to try to get better at it. Right. So I've learned some lessons. I'll tweak some things, but we're going to get better at, instead of saying, all right, we can go back to normal.
Yeah, absolutely. I'll share with our audience that just before this meeting, I was with our executive leadership team, and I've been preparing for a COVID-19 update for our broad staff for next week. And I gave them the heads up that the message that I'm creating based on the medical literature research, so this is like the deep dive down into the studies that are going on around the world. I gave them a heads up that the next 6 months plus will be mildly optimistic with a cautionary tone. And so you can interpret that as you will, but Brian, I see the summer very similar to last.
Thank you.
Yeah. Let me ask you another question. This is actually a common theme type of question that we've used throughout this whole series. What do you do to stay tuned into what your employees are going through during the pandemic? So you mentioned somewhat about in the work environment, but I'm expanding that a little bit beyond. This is about taking care of your people at this point.
Last year, that became the two primary focuses we looked at last summer as providing a safe place for our community and customers to come and have some sense of normalcy. They couldn't do a lot of the things that they normally would do in the summer, but come out, have a lobster roll, piece of blueberry pie, etc. For our staff, it really was, we changed our scheduling. Everything was a little bit more flexible. And because the stress of dealing with the public was immense, if you were the person outside, and having to deal with customers who weren't, it's certainly at the very beginning, almost every customer, there was some kind of a cross between angry at what the world was and real disorientation about what the rules are. People, new set of social rules for going out to eat. Oh, you got to be 6 foot apart. You got to have a mask on. You got to use hand sanitizers. One person in the bathroom at a time, in one door, out the other door. No parties larger than 8. We have a whole social construct of people that know they've been taught for years how to go out to eat. Totally all different. So we had rotated our employees around, and then just keeping tabs on their home life, what was happening there, especially when it came into the summer season, and just listening, and really it was a lot about body language and listening to the stress in their voice when they would come in the back door, certainly when they were talking to each other. So I was more reading them and just seeing their level of stress. And then especially compounding what that did if there was a customer who was kind of unreasonably angry about the situation that the world was in, and taking it out on our employees.
That's awesome. I have another question for you, Brian, here from one of our audience members, and this may prove to be the most important question of all. Has your cake business survived the pandemic?
Yeah, we have. Yeah, we're survivors, and most of the people that are in the hospitality industry have done a phenomenal job. The restaurants here in town turned themselves upside down. But it's really been because of community support. We love our customers. We have our regulars. We look forward to seeing them when they come in. So here's a chance for me to plug the general public and what they've done. They've tipped for online ordering so that employees, that was really helpful last summer. We did a thing where everybody who helped put the order out, got to share in some of that. So, people looked forward to coming to work. So thank you, to the public out there for supporting your local restaurants.
Yeah, thanks, Brian. I think we may have time. Mary, I'm going to squeeze in a question for you. Is there a buying cooperative for PPE that small business owners can join that you may be aware of?
I think that your best thing is go to your Chamber of Commerce websites. There's nothing that I am currently aware of, but I can certainly dig into it and ask around, and we can put it out with the slide deck.
Awesome. Oh, that'd be great. Okay, well, thanks, Mary. Boy, oh boy, I could think of so many questions for you guys, but alas, we're at the top of the hour just about. So I'm going to make this last question for Brian. This has certainly been a year of learning for all of us. What do you want to share with our audience that you really want them to take away from this session today? Brian?
Well, it's really about, as I said earlier, is looking for the silver linings in what this has done to us. We appreciate so many more things now that we might have taken for granted. We've looked for new opportunities to serve our guests and take care of our employees. So it's there are two kinds of people. There's those that complain every day about the situation that they're in, and then there are others who are saying, okay, this is the hand I've been dealt, and I'm going to make this work, and I'm going to win. So it's you know, it's looking for those silver linings that have been presented to us is what I would say.
Well, I wanted to ask you questions about your eternal optimism, but I ran out of time today for that. So we've included some tools for you at the end of this presentation. Thank you all for joining us, and thank you to each of our speakers. I hope this hour has been a help to support you, your employees, and our communities to safely manage your business. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information. Our next session will be on April 8th. Our theme is Unique Opportunities COVID-19 has provided. We'll take a look at recruitment and retention of employees, supporting a remote workforce, growing together through trauma, and the latest on COVID-19 and vaccinations. We will send you the link for this session. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will keep Maine safe. Thank you and have a good afternoon.